and welcome to the COVID-19 Vaccine Town Hall, brought to you by the Virgin Islands Department of Health and the Office of the Governor. I am Department of Health Assistant Commissioner, Dr. Nicole Cragwell-Sims, and your moderator for this evening's Town Hall. You are joining us live from the University of the Virgin Islands Research and Technology Park on St. Croix. This evening's Town Hall will be a healthy discussion with members of our community who have various perspectives on the COVID-19 vaccines. Joining me in this very important discussion will be the Virgin Islands Health Commissioner, Justa Tita Encarnacion, and 6 members from our community who have volunteered to share parts of themselves with us. You will hear stories of loss, survival, some questions around the vaccine's effectiveness, and the why or why not around vaccine choices. The views expressed tonight are those of our guests and are not necessarily that of the Brian Roach administration, the Virgin Islands Department of Health, or the University of the Virgin Islands, but they are all part of this essential ongoing conversation. All of tonight's guests are either vaccinated or were tested today and are COVID negative. So let's begin. Good evening, Commissioner.
Good evening, Dr. Sims.
How are you?
I'm well.
Welcome to my show. I didn't want to tell you, but this is my new gig. So, Commissioner, before we dive in, I'm going to give you the opportunity to just offer some opening words on tonight's point, what we want to do this evening, our panel, and how we would like the night to flow.
Well, first of all, the answer to your question, if you can leave, no. So it's always a pleasure to be in conversation with you, whether it be in or off camera. So thank you so much for agreeing to do this.
Absolutely.
We've been speaking about this for some time now, and just to really be able to bring individuals from out of the community and actually let us know how they feel. And I have to tell you that yesterday we had a disparity. Dr. Hunt and I, we are on an equity task force. And one of the things that I said to them is that, you know, healthcare workers, we need to just really get over ourselves a little bit and listen. And so this is just all about that. Listening to those who are in favor of vaccination. Listen to those who are not and why, and see how we can. Because really and truly, the end goal is for us to come out of the pandemic. And I keep saying the word pandemic because I don't think that the community here in the Virgin Islands, as well as nationally and internationally, really knows what that means or what it could mean to us in the future.
I agree with that. So I would like to actually take this opportunity to maybe have you express some of the ways that persons should be thinking about this pandemic.
Well, first of all, we haven't had a pandemic for 100 years, right? So we too are learning. But what we have had, we've had episodes of infectious diseases that have caused us to go into panic. And I would say, let's start with smallpox. That's one of the ones that I think that we speak about a lot. And, you know, looking at, of course, I have to tell you, my chief of staff, Shana, always says, I don't want you on Facebook. But I do ever so often. And one of the cartoon captions that I saw spoke about this grandmother with a smallpox mark on her shoulder. And the grandson said, Grandma, what do you have on your shoulder? And she explained, you know, when I was younger, smallpox was there and what it was. And I actually got a vaccination. And that's what the mark that you're seeing. It's a scar because of that. And he said, well, how come I don't have one? She said, because it worked. Mm-hmm. And of course, that was not a pandemic. However, it was an infectious disease that caused a lot of illness, a lot of death. And right now, we are in a real pandemic. And that's what we're asking, for individuals to really understand not what is happening today, but what could be happening in the future. Their financial implications, their emotional, their behavioral health implications, and of course, their physiological implications, because some of the symptoms that you see with COVID aren't always what you see, what you're going to see. Mm-hmm. In other words, they're long-term effects of COVID. And of course, we have Dr. Hunt Caesar here with us who can explain a little bit more. She happens to be an infectious disease specialist. I think we're blessed to have her on our team. So she'll be able to give you a little bit more detailed answers to those as well.
Absolutely. She's also my classmate, shameless plug. So I'm going to go ahead into the first question. Cindy Clearwater has joined us this evening. So I'm going to have Cindy come up, give us a little bit of background, and launch right into the discussion.
Thank you so much. First, I want to thank the Department of Health and the Office of the Governor, Commissioner Encarnacion, Dr. Sims, Dr. Hunt-Caesar, for this opportunity for the community to get some answers, because I think there's so much misinformation out there. Personally, I have some autoimmune issues, and I've suffered from bronchitis for many, many years, every year, repeatedly. So when early on, when the vaccine became available to me, I took the opportunity right away. In my personal experience, I've noticed that since the pandemic began, and I've worn a mask, and I also got a flu shot for the first time last year, I've not been sick once since. And I was very sick at the end of 2019. So to me, I feel that in my personal experience, these things have worked. They've kept me safe. That being said, I am in agreement personally of the mandate for hospital and healthcare workers at our hospitals to be vaccinated, particularly because on St. Croix, we only have one hospital. If our healthcare workers are in crisis, we don't have any other options. And that being said, on the heels of President Biden's announcement last night to mandate federal offices to be vaccinated, and knowing that our local offices have been closed so many times because of exposure, are there plans for our local government offices to be mandated to be vaccinated as well?
Thank you so much, Cindy, for that question. So, Commissioner, Cindy just came out the gate with the heart, okay. So, Commissioner, mandates, how are we feeling about that locally?
We've actually been having some conversations about mandates. The university actually was the first place to actually put some mandates in place. And of course, then the territorial board, which I happen to be a part of, did work with both hospitals to mandate the clinical staff and the non-clinical staff in terms of mandatory vaccine. And so I have to tell you that I think that, I know that in JFL we saw 15% more vaccination rate, and in RLS, I think it was even a little higher. And so that is having an effect. In reference to the government of the Virgin Islands, I know that the governor right now doesn't feel like we need to push mandates, but at the same time, there has to be incentives to vaccinate. So right now, he's focusing more on what incentives can actually be given, and we did very well with the educational incentive. We're back in school. Some schools did have to be closed within the last couple of days, of course, because of exposure. However, we know that a lot of our teachers did take an opportunity to become vaccinated. And then, of course, now the clinical or the healthcare incentive is going on right now in terms of the lottery. So we're hoping to get a lot more healthcare workers vaccinated. Of course, in time, depending on the numbers that we're seeing, it may be something that we're thinking about in the future. But for right now, I think it's try to let's see who we can actually entice and really understand. And this is what this is all about. So thank you all for being here. We need to understand the why, and we need to understand the why not.
Absolutely. And speaking about incentives, don't be surprised when you see that name pulled, okay? It's going to be SYMS. One of the things that Cindy mentioned is that, she did have some underlying health conditions. So my question to you is, do you think that persons who don't have underlying health conditions are kind of taking this for granted a little bit?
Well, I think that there's some people who may have underlying health conditions that don't know or think they have underlying health conditions. Obesity is one of them. And a lot of people don't think that that is a condition that you should be concerned about when it comes to COVID. But indeed, some of our first cases that passed away was due to obesity and nothing else. And so that's one of the things I think that they need to understand. Of course, diabetes, sometimes you think your diabetes is under control, and that may not be the case when it's affected by something like COVID-19. So those are the things that we need to take into consideration.
Absolutely. Thank you so much for that, Commissioner. One more question in terms of Cindy's report. We follow a lot of what the mainland is doing. Of course, President Biden is President Biden. How close are the plans for the territory? I don't think people really understand how the planning works with the Department of Health. I'm going to step outside of the Department of Health. I just feel like they don't get it. So can you just let them know how that process is?
Well, let me just look at the VI National Guard. That's federal. The Army now, everything is mandatory. Vaccines are mandatory, so we're working very closely with our Major General, Max Limbacher, to have their staff vaccinated. So we're doing pop-ups so that they can actually they have been working with us from the beginning.
Yes.
So we have pledged that whatever they need, we will work with them. So we're doing that. So that's just basic. Of course, with the other federal partners, whatever we need to do. So we are impacted. We have more federal partners on this within a territory than I think people know.
Yes.
And so whatever we need to get them vaccinated, that's a big start. So it'll increase our numbers because we do have employees. All of our postal officers, they are federal partners. That's just every time you go into the post office, you're entering federal territories.
Right, right. Okay, so let's take another question. Dr. Wendy Coram-Viale is here with us. Thank you for joining us, Wendy.
Thank you so much for hosting this town hall meeting. It's been a pleasure to be here, and I look forward to being a part of this town hall. I'm Dr. Wendy Coram-Viale. I'm a naturopathic physician, and I also work here at the University of the Virgin Islands. And I did have COVID, and I survived, and I am very grateful. And I, of course, know of others and have family members who did not fare so well. One of my questions is, and I hope this can be answered here this evening, is to really explain the science behind giving a vaccine to boost antibodies after actually having the infection, because this has not been common practice after having an infection to really give a vaccine. And this is one of the questions that have come up. I see patients who, and let me make it clear, I am not against vaccinations. I have been vaccinated. The last time I was vaccinated was when I went to Ghana and I took the yellow fever vaccine. So this is not about me being against vaccinated, but just really trying to understand the science so that I can make an educated decision about whether or not taking the vaccine at this point in time is really worth it.
And that is because you did
I did have COVID. I had the whole shebang. And I'm really trying to understand what is it about the vaccine that supersedes natural immunity, to really
That's an excellent question. Yeah. And Dr. Hunt will follow up with that answer.
Certainly,
What
yes.
I will start to say is that when you actually contract the virus itself, there is a shorter immunity span. That's the first thing. And the second thing is that we've been developing variants to COVID-19, the alpha. We are now, that the Mu is here, and we've actually detected the Mu within a territory. And you know that 96% of the cases are Delta, which is the strongest of virus, not just the variant, but the virus that we have seen within the world. So just looking at that says that if you have not gotten the COVID-19 and it is the strain of the Delta, the possibility of you contracting that virus again is strong. So it's a very shorter, the immunity process is shorter, that's the first thing. But I'll let the expert expound upon that when she comes up.
Well, I look forward to that conversation. Thank you so much.
Thank you so much for your question, Wendy, which leads me to ask, Commissioner, a lot of people, Dr. Coram asked it in a very nice political way, but a lot of people are like, man, I don't get that thing, they don't need this vaccine, blah, 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 because all of a sudden they feel very super unempowered, almost like, it's never going to affect them, it's going to last forever, et cetera. How does the Department of Health, and this would be a holistic question, the messaging, the science behind it in terms of, no, that is in fact not the case?
Well, it's not just the science of it, it's the understanding of how people are actually thinking. So I'm going to do this. As a psychologist and as the Commissioner of Health, Assistant Commissioner of Health, you tell me, Assistant Commissioner, what do you think that we need to do or what can be done differently? Because a lot of it has to do with the understanding. Yes. When you speak about the science, I think that the Department of Health, Dr. Esther Ellis, Dr. Hunt, and we've actually brought in other individuals as well to teach the public about the science. Let's put the science aside for a little bit and speak about the emotional aspect and what people are fearful of.
I think the beginning of that, and that's a very good point, the fear supersedes any research that I would ever do. If I'm afraid of something, all of that shuts down. I'm not thinking about going and researching anything. You can who me to death, I'm not going to do it. I'm not going on any websites. I'm not reading any books. And I think the Department of Health, which has done an excellent job, this included, has messaging around what is factual and what is not from inception, I think has been great. Not just because I work here, but I think it's been great. The Facebook, the social media, the interactions, the discussions, we've also done a great job of breaking things down. A lot of times we get it globally, and so we would take that, massage it, and break it down for this community. So it boils down to persons listening and wanting to accept the information. Like you said, it's been 100 years since the last big, situation. So for them, a lot of them are like, I'm not familiar with this. I don't know. And they don't have persons that they can speak with about it.
Right. And, going back to the basic question, you got COVID once doesn't necessarily mean you cannot get COVID again. Mm-hmm. And so that's why the vaccine gives you a little bit stronger of immunity to protect you against that.
Absolutely. So in terms of messaging, let me ask you, is there plans for like a massage, a change in the way they deliver so it's not like white noise? Because I know now a lot of things that are kind of repetitious, people are like, I don't want to hear it.
I have to tell you that MCH, our Maternal Child Health Program, Director Mayers, Dr. Mayer, she's done a tremendous job. And we actually have jingles out there. So a lot of times, right, children actually have an impact on their parents. And teaching the children what the benefits of the vaccine is actually a good thing. And it's not to get them to think differently, but actually to teach them what the history and right now what the science is. And a lot of children are interested in science. And then they too can teach their parents, or, especially those who don't really fully understand. And I think that's one of the things that MCH has done. We have a beautiful jingle that's out. We've done a lot of outreach. They've connected with our communicable disease division so that they do those outreach together. So the communicable disease have more of the science to it. Of course, our physicians and our nurses are added to that conversations as well. But I think that if we really touch the hearts of children, and I think they in turn will be able to at least ask mommy or daddy or grandma or grandpa, why not?
Right. Where's your mask? What's going on?
Right. Yeah.
So in terms of the Department of Health and controlling the situation, I think we've done a tremendous job. Now, on the one side, it's like, yay, Department of Health. On the other side, you haven't been exposed to the point where you're like, I need to do something about it. So it's a catch-22 in essence. What are your feelings about something like that?
We're all exposed. This is community transmission. That means that you can actually contract COVID from anyone. And I think that that's a reality. So you are all exposed. That's just a given. You have to, that is a reality. So, I always say, when you go and you have dinner with some friends and you take your mask off, a shield doesn't go around you automatically. This is your shield. Mm-hmm. And when you take your mask off and you're having dinner, and not everyone has been vaccinated, once you become vaccinated, your mode of transmission is a little bit lower than if you're unvaccinated. The transmission, your viral load is higher, so it's easier for you to transmit it. So we are all, I said it to say again, we are all in an exposure period at this point in time.
Right, absolutely.
Look at, we actually had to do an emergency press conference yesterday because schools were closed. 2 in particular schools were closed. That's because individuals, and I think it's also understanding, a mother or father, or sister, brother may have had COVID at home, and because the younger one isn't sick or doesn't look like he or she is sick, it's okay for them to go to school, but I'll check on them. But at the same time, that person may start coughing when they go to school, may be tested, and then of course that person is positive. Everyone around them, and they have been exposed to, especially without a mask, have been exposed.
Absolutely. Well, let's launch into a video. We've had some on-the-street testimonials. We're going to one of those right now.
Thank you.
No, I'm not vaccinated, and I follow the strong advisement from my multiple medical physicians So due to highly probable adverse effects from the vaccine, my medical history supports that I'm not a good candidate for taking it. And I'm not the only one. There are other people who have medically compromised contradictions, and they have high risk of adverse effects to the vaccine. So contrary to popular belief, I personally am not for or against the vaccine.
Thank you.
Sure.
Thoughts on that?
Well, you know, I have to tell you that one of the things that is always said is that in terms of medical implication as to why you shouldn't get the vaccine, severe allergy to other vaccines, and as well as the COVID vaccine if you have gotten the first dose, is a good reason for you not to have the vaccine. Not necessarily immunocompromised situations. Asthma is definitely not one. Other autoimmune deficiencies, that's not a one as well. But the fact that you have been maybe severely allergic to others is one of the reasons why it's truly acceptable.
Absolutely. Well, we have the pleasure of actually having Dara Cooper here with us today. So Dara, if you would join us at the mic, you can expound a little bit on a little bit of background, your video, and ask any questions you may have.
Sure. Hi. Good evening. Thank you, Commissioner, Assistant Commissioner, and all of the rest of you in the room. I'm a little vertically challenged here, but I can speak taller than I actually am, so it's okay. Class of '97, we make amazing things happen.
That's correct.
In the room. Yes. So, as you know, as my video shared, there are some people, like you mentioned, who don't fit the bracket of those who are good candidates for the vaccine. Those aren't necessarily the conversations too many of us may want to have, because then all of a sudden everybody will have those same things, and I've heard that many times before, so I know that that's one of the reasons we don't go into sharing some of those things. But at least for the understanding, without going into detail with too many of those, with my doing research on this as a student, I'm a PhD student at the university here at the Virgin Islands, studying how media and messaging helps us to interpret and understand and then make behavioral changes to this current situation and others. And I think it's really important for us to focus on and understand that, because as a marketer too, you kind of know what can help to encourage more people one way or the other. Now, as a journalist, you don't want to be the ones telling people what to do. So that's why I said I'm not for or against, and I'm never going to tell someone to or not to. But that doesn't mean that I don't help people who want to go get it. And that doesn't mean that for those who don't want to, I listen. And that's what I think is important, that people are able to be heard. So for those many questions that come up, there are people, there's a comment in the chat right now by someone asking, continuing the conversation with Dr. Wendy Cornvielle about natural immunity and what they've found and researched, and it lasting longer than some places say. There's so much information out there. Two questions. What do you do to help people understand where to find accurate information, as well as what are those situations where you may want to go and get yourself medically screened to make sure that you're not one of those people that's possibly not a good candidate?
Well, everyone should have a primary care physician. That's just a given. And so I think that would be your first choice, is to looking at your primary care physician and seeing what he or she feels, and they have your history. And so they know what has happened to you in the past, what hasn't, what has affected you, what has not affected you. So I would say that would be the primary reason. In reference to the information, I'm going to wait until Dr. Hunt, based on the fact that I've already given some information. But actually, I wish I could just pull her on and just push her right here. But I'm going to wait until she actually gives you more detailed information about that. But I want to just say thank you for just being very objective. And I think that a lot of times individuals who have not been vaccinated push others to not be vaccinated. Mm-hmm. And it's kind of, I guess you could say, well, I was vaccinated and I'm pushing others to be. That's my responsibility. I'm here to protect you. I'm asking you to help me help you, right? But at the same time, I really appreciate the fact that you're very objective with what you said, and that you're asking others also to seek information. Of course, you have the World Health Organization, you have the Center for Disease Control and Prevention, which actually Irvin is also working with at this point in time. But then you also have the infectious disease, you have epidemiology. So you have so many different organizations that you can actually look into that studies the science of COVID-19, historically of infectious disease that you can. A lot of these individuals who are asking the questions are always on the internet. You just have to go to the right site. The two basic sites right now are World Health Organization and the Center for Disease Control and Prevention.
Okay, thank you. And that's more
And
nationally.
of course, the Virgin Islands Department of Health.
So many plugs going in this place of electricity. But that's for those who are in the United States, a lot of time following those. I know that there are others outside of the U.S. Are there any others?
Outside of the U.S., well, the World Health Organization is worldwide, and they actually have on Facebook. They have a lot of press conferences, and they have their lead epidemiologists running those press conferences, and they give a wealth of information.
You know, one of the things that I did once I got the vaccine is I went Facebook Live. I know a lot of times the acronyms alone are difficult. It can be so much information and people are overloaded. They just want you to just get to the chase, tell me what's happening, good, bad, yes, no. And we don't want to do that because, like the commissioner said, it is your choice. However, we don't want you to shut off either. And so when I got it, I was like, okay, Nicole, one of two things will happen. On Facebook Live, you will melt away. You know what I mean? Like, because early on when I got the vaccine, we were talking like, you know, forgive me for saying this, but like third boob kind of superpowers and things were coming. Remember that? The vaccine was going to give you another hand and another head. And I was like, oh my gosh, I'm going to be famous. And it didn't happen. But I think the lives every day really changed a lot of people's perspective because we weren't talking at persons anymore. It was kind of like, okay, she works for health. Let me see what happens. And of course, it turned into they actually injected me with water, which I couldn't dispel. But you know, people are people, right? So it's kind of like whatever. But what Dara says, Commissioner, actually is a really good point in terms of, and I mentioned it before, we get national information. We didn't have to tweak it locally. So that leads me to, I guess, the question of culturally, how do we then massage it that it's cultural and people understand? Because growing up, anything hurt you, what did you do? You put Vicks on it. Or you drank a ginger ale. Like, let's be real, right? Okay. So how did we then keep the science and still say, listen, I know we're people who are very warm and hug and, you know, touch, and we had to break a lot of that.
Well, let me just go to, you know, you look at herbal medicine, and I'm not opposed to herbal medicine. And you and I go visit Ras Babi every so often, right?
Always, always.
Okay, so I think that piece is important. That is part of our culture. That is part of who we are. The key thing, and I don't care what you're doing, if you're hypertensive and you're taking a herbal medicine that can decrease your blood pressure, you should be speaking with your physician because you need to balance it. So there's always a balance that needs to really be there. In terms of taking herbal therapy to increase your immunity, if it's not affecting something else within your body, within your system, whether it be your blood pressure, your diabetes, your sugar, as we call it, then that's different. But you have to sit with your primary care provider to be able to say, this is what I'm taking. I know I'm taking this medication that you give me every day, but you know, let's put it this way. You can wake up and not really feel good, be a little bit disoriented, and that's because your sugar is very, very low.
Right. Mm-hmm.
Why is it low? Because you're actually taking herbal medicine created traditional medicine.
Right, right.
You know, so you kind of.
So let me ask you this. Earlier you mentioned actually when Ms. Cooper was here that, you know, you're accountable. You have to be accountable. You are the Commissioner of Health. But you also come from a very large family, which then makes it personal because you're the Commissioner of Health. How do you deal with that?
I cuss them out ever so often.
Yes.
I actually have to tell you that I had lunch with my family on Saturday, and I told one of my nieces, I said, I'm going to go on the TV and I'm going to talk about you. And she was like, Auntie, you can't do that. So she knows who I'm speaking about. That's good enough. But she is not vaccinated. And so I think but so I encourage. I really encourage. I'm a little bit more forceful because it's family and I love them and they know I love them and I'm Antita, so I could do it. But at the same time, I ask them to take it seriously And I have to tell you that I was driving with both my sisters one day, and neither of them were vaccinated. They're vaccinated now. And I was talking, and they were like going back and forth, and I said, "How is it going to look?" And one of them said, "Why, because you're Commissioner of Health?" And I said, "Yes." They said, "Okay, you could drive me now. I'll go get vaccinated."
Oh, gosh. Okay, we're going to take a quick break, and we'll be right back.
But what you saying, Jimmy? Means you're in a hot minute, you know. We're going to say, it's been a hot minute for a reason. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out there for a little bit, but still, I just have some fun, though. Well, my side can't leave the house when I get vaccinated. But you won't scared of the vaccine? Nah, sis. The vaccine's safe.
VI people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better, not worse.
I want a COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe.
Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated.
I want a COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe.
Brought to you by the Virgin Islands Department of Health MCH program.
Has the COVID pandemic caused you to fall behind on your rent? What about your electric or water bills? Well, VIHFA's Emergency Rental Assistance Program is here to help you catch up. For program details and qualifications, go to VIHFA and click on the ERAP link. From there, it's just 3 steps. 1. Make sure you are eligible. Have you lost income due to COVID-19, owe at least 1 month of rent or utilities, and meet the federal household income guidelines for your island? 2. Gather all the required ID and documentation for all members of your household, plus statements from your landlord or utility company. 3. Submit your application online at vihfa.gov or call one of the intake centers on your island to make an appointment to apply in person. For more details and locations of the intake centers, please visit vihfa.gov.
Okay, great. Thank you.
Hey, you.
Hey, babe. Thanks for lunch.
You're welcome. Who is that?
That was a representative from the Virgin Islands Department of Health. They're doing a survey called BRFSS.
Oh, for what?
It's to address chronic diseases facing the Virgin Islands. Diabetes, heart and kidney disease, cancer, stroke, and more.
What kind of questions do they ask?
They ask questions about food, exercise, age, smoking, and some others.
Is that all they ask? Do they ask questions about...
Security? No. They don't ask anything about Social Security, money, or credit card information. The information that they do collect is used to guide public health programs that affect all of us. You, me, the kids, the community, and the entire Virgin Islands.
Oh, okay. Very interesting. I'm glad we could do our part to help.
Yes, we've got to do our part.
For more information, visit our website or call John Orr at 340-643-5422.
And welcome back to our town hall meeting sponsored by the Department of Health and the Office of the Governor. We've been joined by Dr. Hunt Caesar. Welcome.
Thank you.
How are you?
Well,
You've been observing from the side, so I
Yes.
know you've heard a lot of the discussion. What are your thoughts?
I've been itching to jump in, but Commissioner Encarnacion did perfect. She answered all the questions well, and I'm just happy to hear from all of the different perspectives and just to, continue the discussion.
So we're actually going to jump into some more kind of pointed questions, but I know there was a lot of scientific questions, and I'm sure the chat is blowing up with the science behind everything. We've talked about, natural immunity versus the vaccine. What does that mean? The longevity, herbal, etc. So that definitely is going to lead us to some really great discussion. But at this point in time, I'm going to have Mr. Julian come to the mic, give us a little information, and, share with us anything that you have, to include any questions you may have.
Hi, good evening. Thank you, Commissioner Encarnacion, Assistant Commissioner Nicole Sims, Dr. Hunt. I would first like to thank the Office of the Governor for having this forum. I think the Department of Health has been doing an amazing job with this pandemic. It's the first that we've ever had. I don't necessarily have a question. I've been fully vaccinated. I would like to use my time to say the reasons why I got vaccinated. So it was because I needed to go to California. And at that time, California had a spike. And I figured I'll just get vaccinated. And that was in January. And then working along, I actually work with the Center for Disease Control and Prevention. I see the back doors of what this pandemic has done to the nation. And it's scary. And then one day, COVID came and knocked on my door. And it took one of my cousins away. And then it came knocking again. And it took another cousin away. So in a span of 6 to 8 months, I lost 2 family members to COVID. Very young, very healthy, more healthy than I am, but not vaccinated. And it's to me, I feel that what maybe we can do as a community is to maybe share our stories, because I know there's individuals that's hesitant about the vaccination. But I'm speaking to the community now, not the Department of Health, because you guys are the experts. I'm more speaking to the followers on Facebook. You don't want to feel that pain. You don't want to feel that hurt. You don't want to go through that expense. And the commissioner mentioned earlier that COVID is more than just a virus. It's economical, it's financial, and it hurts. And it reminds me of gun violence in the Virgin Islands and hearing that single mother cry for her child because it's so unexpected. You know, I'm not against people not being vaccinated or people being vaccinated. It's your choice. I don't feel that the government is pressuring or the department is pressuring. I think what you guys are doing, and I think what I am trying to do right now, is to encourage family members, neighbors, friends, don't put yourself through this nightmare, because one day is gonna knock on your door. So my question now I gave my little story, and why I got vaccinated, and I'll actually show something else in. To this day, I still haven't started to even grieve my family yet, at all. That's how difficult it is. It's so hard. My question, because of our culture, does the Department of Health and the Office of the Governor, is there a plan in place that's culturally sound to inform our elders to be vaccinated? And if they don't want to get vaccinated, what other steps can they do? My father is 80 years old and he's not getting vaccinated, and he never will. So how can we make this now a local, culturally sound message? If you don't want to go and get vaccinated, this is what you need to do. And wear your mask, soap and water, doesn't work. So how can we, and the only thing that works, I think, is passion, maybe. But is there a plan with the Department of Health to literally get into the community, and because of our spike, get into the community and really deliver that message that one of these days, this pandemic, this virus will knock on your door? So is there a plan in place, or if there isn't, what can we do? And can we be involved, the community be involved, along with the Department of Health and the Office of the Governor, and put this message out that COVID is here, and COVID is here to stay. COVID is not going anywhere. How can we deliver that message? Thank you so much for your time.
Thank you. Want me to start?
Thank you. Please.
Okay, one of the things that most recently is we received a grant from where you work, the Center for Disease Control and Prevention, having to do with disparity. And of course, we are people of culture, people of color within a territory. And that's really and truly one of the reasons we asked and we received funding for that grant. And that grant is now going to allow us to go further into the community. We already have the mobile vaccine task force out there. However, I think with an increased number of outreach workers, making sure that we have individuals that are speaking the dialect, the languages that we have within a territory, I think that's going to make a big difference. I reached out to some folks yesterday and asked them if we can actually have a hotline, not just a hotline to call in and have vaccinations appointments, but to actually have a hotline where you have various languages spoken so that you can actually understand what's being said in your own language and have questions answered. And at the end of that, still have that person capable of making an appointment for you to be vaccinated. It's about thinking outside the box, and we're prepared to do that. This forum isn't the last forum that we're going to have. The only reason why we have only 6 people in the audience is because of COVID. And so we have to, when we're able to have more, we will have more of various demographics. So those are some of the things that we can do, but I'm sure that these 2 young ladies here can also speak about some of the things that we can do differently.
Absolutely. Dr. Hunt?
Sure. Well, I think it's, you brought up several important pieces. And to go along with all the things that we are trying to do with our funding, it also has to do with all of the other partners that we work with. The Department of Health can't do it alone. So while we engage with trying to get funding to provide various services, you specifically talked about the elderly. So we work very closely with Department of Human Services to really make sure that that they convey the messages and we utilize their services. Getting out into the community is difficult now in the pandemic to be safe, but reaching out to all of the healthcare workers in the community who provide the services is critical. So we know that we can't do it alone, and we rely heavily and work closely with all of our various organizations that we partner with to try to get the messages out and to try to help. You brought up how else can we do in addition to people who won't get the vaccine. Well, we have to continue with all of our different layers of protection and ensure that if your father won't get the vaccine, that we try to say, well, maybe everybody around him can get the vaccine and add that level of protection, which goes to community immunity. If those individuals who can't get vaccinated or will not, they will still be protected if everyone else gets vaccinated.
Right. I don't know who paid you to try to make me cry, but it's not going to work. We're going to go ahead to a video at this moment. Take a look.
I chose to get vaccinated for several reasons. Vaccines have been around for decades, and they have been curtailing the widespread of diseases for years. I'm trusting the science and the word of my doctor because my doctor has been taking great care of me for years. I reside with a senior. It's important that I protect her and myself. Lastly, it was my choice, and I choose to do so because I can.
Thank you. Okay, and welcome back. So what we're going to do now is actually take some questions. We have a lot happening on Facebook, I'm sure, with the spirited discussions and questions. So we'll take this one. Why should I get the vaccine if I can still get COVID and spread it? Eeny, meeny, miny.
I'll
Dr.
take
Hunt?
that, yes. So the answer to that is simple. The vaccine actually really reduces the chance of you actually acquiring and spreading COVID dramatically. Yes, the possibility still exists, but it really, really reduces it. And without saying it anymore or trying to complicate it, that's just basically the truth. So the reason why you should get it is also not just to limit the spread, but also to prevent yourself from getting into the hospital and dying, because really that is why the vaccine was actually developed, okay? It wasn't really to stop people from getting COVID. It was really to protect you and save your life in the event that you actually do contract COVID.
You have anything, Commissioner?
No, thank you so much, Dr. Hunt. Thanks,
I'm going to take
pleasure.
another question. The vaccine changes your DNA.
So I'll take that as well. So that is absolutely just not true. So what is DNA? And I think that many individuals who are going around thinking this and saying it need to try to potentially like understand what DNA is and what it does. It's actually something that is predetermined before you were born. And it's in all of our cells. It codes who we are. So something can't change your DNA, okay? That's just not, I should say specifically a vaccine doesn't change your DNA. The messenger RNA vaccine, which is one of the one type of the two different types of vaccines that we actually do have, is a misnomer for people who are believing that it actually has something to do with DNA. It is a vector. It's the way that the message is transmitted to your body to produce the response. And the vaccine actually never enters the nucleus where your DNA is actually housed. So there is no interaction. There's no way it can change it. It's just not possible. And the millions and billions of people who've been vaccinated already have not had their DNA altered.
So we've had some concerns very early on too with pregnant women and babies. So of course, what does COVID do to babies?
Okay, I can take that question as well. So we know that from research we've been seeing, or the studies and the way that this pandemic has shaped out, that COVID has adversely affected or caused more harm in those people who are elderly and have more underlying health conditions and comorbidities such as obesity, which was stated before. However, anyone, anyone, infants and all the way up to adults, can, of course, get infected with COVID. When children do get infected with COVID, as we are seeing now with the Delta variant, we're seeing that they are actually getting in the hospital more frequently than with the previous variants or strains of COVID. And they actually have the same manifestations, respiratory illnesses, fever, diarrhea. But what we do see in children that we had seen early on in the disease spectrum is that when they recover from COVID, they might actually have a very sensitive or a very dramatic inflammatory response in which they sometimes have what's considered a vasculitis or a syndrome that's very similar to what we were described as a vasculitis, a Kawasaki's-like syndrome, in which they have really bad fevers, they get very swollen, and it can actually really cause them to die. It can be fatal without proper and prompt medical treatment. So COVID-19 can actually provide the same sort of fever or febrile illness in babies, but then it can also be very harmful and detrimental and fatal when they actually recover several weeks later after recovering from the virus.
So who is really responsible for spreading COVID-19, the vaccinated or the unvaccinated?
So, I mean, without mincing words, like just listening to the science and understanding the way that the vaccine works and how it doesn't work. When you are vaccinated against COVID-19, you build natural antibodies from your immune system. You develop your own antibodies naturally within your body. And that is already there and present. So by the time, if you are actually exposed to COVID-19, you are less likely to have a response that will actually make you contagious. So stating what I said before, you are absolutely dramatically less likely to actually spread COVID-19.
Dr. Hunt, I have a question for you.
Yes,
that
ma'am.
comes after that. How does a virus work?
The way that a virus works, Once you become exposed to a virus by inhaling the virus or touching your face and contaminating yourself, if you pick up the virus on your hands from different surfaces, it enters into your body and it starts to replicate within your respiratory system if we're talking about the COVID virus. And then you become very contagious because you start to expel it, it's in your nose, it's in your mouth, and that is the way that a virus works. So the virus is actually more contagious and spread more if you are unvaccinated than someone who is vaccinated.
Nice. So we're going to hear now from Chad Shaw. Chad, you're going to give us a little bit of information about yourself and, of course, ask any question you may have.
Very good. Thank you very much for having this. It's good to have all this great information. I came up here to kind of share my story a little bit with everybody and what happened to me. I got COVID in March of 2020. I was in Colorado. I flew right into a hot spot and came down with a light cough. Didn't think anything about it. You live in the Caribbean where it's nice and warm and moist, and you go to the mountains where it's freezing cold and dry, and you start coughing. So I didn't think anything about it. I got back and came down with a fever the evening I got back. I got off the plane and got a fever. Thought, oh God, okay, here we go. So went and got tested and came back positive, and the Department of Health, I have to say, handled it exquisitely. I had phone calls every single day, morning and evening, checking on me, make sure everything was going right. And fortunately for myself and my wife and my son and my daughter, we all got it from me, and we all had very mild cases. But even still, even having a mild case, basing that on just what I've seen, it was still 3 weeks of my life where I could barely get up out of bed to be a father, to be a husband. And so having seen that effect, what I want to see is I want to see life coming back to full circle, the things becoming more normal. And what I would like you to explain is the long term, what we're looking at long term here. You know, we have millions and millions and millions of people that have this virus, and it's developing and developing and developing. We're on Delta, right? If this does not stop, if we don't get vaccinated, if we don't stop this, it's going to continue to develop to the point where, things are going to get worse, and we want them to get better. So if you could speak to the long term of that would be great.
Sure. I think thank you so much for sharing your experience. And I think that to answer that, as an infectious disease student and who has studied pandemics and viruses in the past, we can only look to previous pandemics or outbreaks or exposures as it relates to other various respiratory illnesses and other infections as well, to know and understand exactly what happened. And then looking at viruses such as smallpox that was successfully eradicated off the face of the earth because of the development of a vaccine. I think that when you look back at pandemics before we had vaccines, they lasted several years, anywhere between 3 to 5 years. So as we move through this pandemic, and we don't become the community does not sort of achieve the immunity faster than the virus shifts and changes, which is not anything new to any viruses, because this is how viruses work all the time. It will just continue to just lengthen and cause illness and death, but it will end eventually, I think, and that's when the entire population has either really seen it enough so that the natural host will start to see milder disease, or it consumes us. It's just too early to tell. But I think that because we have the science, we should use it so that we can start to live and not lose any more lives.
Thank you so much. We're going to take a quick break. We'll be right back.
Hi, this is your Senator Samuel Carrion. I am proud to be a Virgin Islander working hard every day to serve you. Because here, we look out for each other. That's why I'm asking you to take Titi Carmen and your primo Jose to get the COVID vaccine. Some say they may ask too many questions. ¿De dónde viene? ¿Cómo llegaste aquí? But that's not true. Only your name, your age, and your phone number. That's it. No ID needed. Así que por favor, vayan a vacunarse para proteger a nuestra gente y a nuestra comunidad.
And welcome back to our town hall. Let's check out another video from the street.
We live in a community that is somewhat religious. Sometimes it appears it's more talk than action in religion. But we, from the beginning, have prayed for relief from this onslaught of the COVID-19 virus. I like to think that God gave us the answer in terms of the rapid finding of a vaccine that blocks the virus when it comes into the body. Yes, I've taken the vaccine. I took it not because I was forced to or anything, but because I understand the science behind the behavior of viruses. My advice to those who may see this is to go take the vaccine. The cure is here. Take the vaccine. There are several choices. Take one of them.
So, I know before, Dr. Wendy Coram, you had some questions, and since we have Dr. Hunt with us, if you could return and lay it on her.
Thank you, Dr. Hunt, for lay it on thick, right? Thank you, Dr. Hunt, for joining us. My question earlier was to explain the science behind given a vaccine to boost antibodies after having the infection, because that has never been common practice in the world of medicine as far as I'm concerned. So, and I'm certain that other persons in the community have that same question. So
yes,
if you can explain that would be great.
That's an excellent question. And I am just very happy and thankful that you are here and in the community really spreading the truth and alternative methods of medicine, okay, and health, I should say. So I'm gonna go to your initial statement. So that's actually not true, to say that it's not common practice to actually boost with antibodies when you actually have an existing infection. We have actually had successful influenza and yes, after the infection. I'm getting there. I'm following you. So we've actually had very successful influenza and pneumonia protocols implemented in all hospitals nationwide because of the success of actually vaccinating for influenza and pneumonia upon discharge when somebody actually presents to the hospital with pneumonia and influenza. So that's actually very common that we immunize individuals who have an active infection in the hospital once they leave, so that they can have an extra protection that the vaccine can actually provide to add to your immune response. As it relates specifically to COVID-19, the reason, I think Commissioner Encarnacion stated it extremely well when she said that we have seen and studied this new sort of immune response because it varies from all viruses and all virus types. And unfortunately, even though the COVID-19 virus or SARS-CoV-2 produces really harmful and lasting and even fatal effects on people in general, it's actually a really wimpy virus as it relates to the immune response in your body, meaning that by the time you think you're recovered, you might actually possibly be waning natural immunity, natural antibodies in your system. So we've actually studied and tried to see how long the antibodies have actually been around, and of course, everyone is going to vary. But sometimes we've seen as early as 2 weeks that those natural antibodies are gone. Sometimes it lasts up to 3 to 4 months, which is usually common. Anywhere between 3 to 6 months is what we've seen the average person will actually have that, okay? As it relates to the vaccine, it will provide much longer lasting immunity, and it also provides protection against all of the strains, not just the one that you were infected with. If you get reinfected with another virus, you might actually have a really more severe effect.
So we're going to take some questions from Facebook. Of course, you know we're live, so they're tracking and they're following. The impact of the virus on teens. Can you tell us a little bit about that?
So the virus does not impact or actually affect the reproductive or any other organ systems in the body. The way that vaccines work is it produces a cellular response, so it does not incorporate into the reproductive organs. There is no impact on sexual health as it relates to fertility or even sexual function.
Say that last part again. There's no on the what now?
There's no impact on fertility or sexual function.
Okay. All right. Let us sink in. And next question. What are some other tools to fight COVID-19?
I think that Dr. Wendy Coram can actually answer that. Other tools to fight COVID-19, we actually studied this from NIH actually, and Dara Cooper actually asked where you can actually find reputable information. And the NIH actually is the National Institute of Health that summarizes all the research, and not just like Western medicine. I mean, they incorporate all sorts of natural components. And there has been other various vitamins that have been shown to be possibly effective. Again, they're not, we still need to do additional clinical trials. And clinical trials actually happen with medicine and vitamins. So zinc, vitamin D, vitamin C are still all available and possible supplements that can also aid and help. But also just drinking water, getting rest, exercising, all of the things that you're supposed to just do naturally that can actually help your body to be, to be very good.
If I may add quickly, vitamin C there have been studies showing the use of vitamin C in ICU hospitals having a really good effect in helping with the recovery efforts. So, vitamin C.
Thank you so much for that. So we've actually come to the end of this evening's town hall, and I think it was fruitful. I think this was a very good direction for both the Office of the Governor as well as the Department of Health. Commissioner, I'll turn to you for closing remarks.
Well, let me first thank Dr. Hall, who's actually been a partner with us for many months, over a year actually, in the fight of COVID. So thank you so much, Dr. Hall, for allowing us to be here today. And of course, thank you all for being part of this discussion, and hope to have you actually part of another discussion in a few months when we talk about how high our vaccine rate is. Right now, we're actually looking at a vaccine rate of fully vaccinated individuals, let's say 12 and over, around 49, and 18 and over, a little over 50. So we actually got to the 50 percentile, and we need to get a little bit more. So we're actually there, and I think that I know we will make our community immunity. As I said it yesterday, and I'll say it today, it's all about who we are, and not one of us can do it by ourselves. It's who we are as a whole, how we do this together, and this is actually a good place we started. Not everyone is in favor of a vaccine. However, we're sitting here talking about it, and this is the way to go, having conversations. Like I said, clinical people sometimes need to just get over themselves. Well, we're getting over ourselves today, so we can listen and we can hear and we can do something with what we've taken away. So thank you so much for hosting this, Dr. Hunt. You see the benefit of having you here. It was awesome. And really and truly, thank you so much. And Dr. What's your name again? Dr. Sims? Oprah.
So I just want to say say thank you so much, everyone, for joining us this evening. Thank you, Facebook Family Commissioner, Dr. Hunt. Tonight, like the Commissioner said, is the beginning of what we want to do. We want to interact more with you. We want to give you that information that you need. We want you to be able to ask questions, share your opinions. There is no favorite, there's no non-favorite. This is facts, this is research, it's us helping one another. Don't forget to write your local congressman if you'd like to see more of me. Other than that, have a good night. Thank you for joining us.